So at 1400 hours at 2 p.m., you receive a patient. Let's identify some keywords or relevant information in this scenario. Now, what you want to do is, I want you to see if the information that you're selecting as important or relevant is the same information I am selecting as important or relevant. Because this is a way for you to prove yourself that you're doing better. So definitely the 32-year-old information, my patient's age, is important. Has a history of uncomplicated mitral valve stenosis. Anytime they tell us about a history, it's important to note it. Mitral valve stenosis that is currently being monitored. The client delivers a 7-pound 4 ounces baby. So we have a delivery via an uncomplicated vaginal delivery. So there was no complication during the delivery. That is important. The client is breastfeeding the baby. Super important. Breastfeeding after the delivery. We're going to see why. Then 1 hour later, at 1500 hours, at 3 p.m., the client's spouse calls the nurse because the client is complaining of abdominal cramping and complains that the peripad feels wet. Uh-oh, we have a change in condition from 2 p.m. to 3 p.m. We have a change in condition from 1400 hours to 1500 hours. What is the change in condition? Well, we have abdominal cramping and peripad feels wet. So we have some bleeding possibly here. So we continue reading. They are providing in this scenario the vital signs. And they're also providing an assessment that the nurse conducted. What did the nurse do? The nurse went to check on the patient and found out that the peripad was saturated with blood. So this is confirmation that there is some bleeding going on. Vital signs: heart rate 120, tachycardia, BP 98/62, borderline hypotension, respiratory rate 24, SpO2 92 on room air. So all these vital signs are important. Now they're giving you information about the fundus. Remember that we are in the postpartum period. So any information about the uterus, the fundus, is important. The fundus is soft and 4 finger breadth above the umbilicus, and here's the key word, deviated to the right. So we have fundus is soft and deviated to the right. So based on this information, now we're gonna do a drag and drop clause style of question. And it looks like this. Based on this scenario, what is an appropriate intervention to do? It says, to meet the client's need, the nurse would immediately plan for option 1 and option 2. So you have to drag, you have to select an answer from the options provided in option 1, and you have to select an answer in the answers provided in option 2. Now, here's the key. You can only select one answer from each side of the table. Remember that there is a keyword here that is immediately. Immediately tells you that this is a prioritization question. So what would you do as a priority nursing intervention in a patient that is bleeding, that has saturated the peripad, is borderline hypotensive, with tachycardia, and the fundus is soft and deviated? So what would be an appropriate intervention? So let's select one for option 1. What do you think is the answer? Comment your answer in the comment section. Are you going to do a uterine massage? Are you going to do a rapid administration of blood? Are you going to do administration of this medication? Or are you going to do a manual exploration of the uterine cavity? So if we're thinking of prioritization here, we have to think, what is an appropriate nursing intervention that will help me stop the problem or will help the patient's problem? We can also see, are there any answers that are outside of the scope of practice of a registered nurse? Do I see any answers that are inappropriate? So I can use the process of elimination. Just because the answers are on a table, that doesn't mean that I cannot use the process of elimination. So, answer number 1, uterine massage. Will that help with this possible uterine atony? Would it help with that bleeding to massage the uterus and help the patient with the bleeding? So answer number 1 is a possible answer. Answer number 2, rapid administration of blood. Well, there's no indication in the clinical scenario that the hemoglobin was checked. There's no information about blood typing. So there's no need for doing a rapid administration of blood. So this one we can eliminate. Answer number 3, this medication. Wow, this is very important. A little bit advanced on pharmacology, but this medication is actually contraindicated in patients that have heart problems. And remember, the beginning of the question gave you a history that stated that the patient has a cardiac history. Therefore, this medication is contraindicated. So therefore, I will eliminate this answer as well. And the manual exploration of the uterine cavity, this is outside my scope of practice. That will be something that the doctor would do if the uterine massage doesn't help with the bleeding. So I can eliminate the last answer. My correct answer would be uterine massage. So we have one side of this question completed. On the side of option 2, I have to select between hysterectomy, uterine tamponade, oxygen administration, and IV infusion of oxytocin. So if you look at this, we're looking for plan that can be done by the nurse because we're dealing with a priority question. So which one of these answers in option 2 can the nurse do? Well, we have oxygen administration, the nurse can do that, and IV infusion of oxytocin, the nurse can do that. So we can eliminate the hysterectomy and the uterine tamponade. Now, in between oxygen administration and IV infusion of oxytocin, what is the correct answer? And you may think, well, if I use Maslow here, oxygen will be the priority. Oh, but be careful. You have to go back to the scenario. Let me show you the scenario again. Let's go back to the scenario. What was the patient's O2 saturation? 92. Although it's on the low range, it's still within normal range. And also, the respiratory rate of 24 is normal because the patient is in pain. Remember, the spouse called reporting that the patient had abdominal cramping. So it's normal for the respiratory rate to be a little bit elevated, and the O2 saturation does not indicate hypoxemia. So yes, oxygen administration is a priority according to Maslow, but it's not the priority in this situation, because the problem here is not oxygen. The problem here is bleeding. So the correct answer will be IV infusion of oxytocin, not the administration of oxygen. You see the importance of really understanding the clinical scenario?